Uganda is the most interesting place right now. But I don't think it's being interesting for corrupt leaders because a lot of them are getting arrested. The hottest place right now is Uganda, especially for corrupt leaders. They have no peace in Uganda because there is something going on called Operation Exposing the Corrupt. And this episode revolves around the corrupt leaders in the health sector when you find your way to Uganda. Now, the first thing we are going to talk about is this video that we are seeing on the screen. Now, what you are seeing on the screen is a toilet infrastructure. And apparently, the person that built this particular toilet spent about, spent about 73 million Ugandan shillings on this particular project that we are seeing on the screen.
This toilet?
The one who did it. Can I explain?
Explain. You are the one who built it? You are the engineer? The in charge? What happened?
Now, who is doing the interrogation in this particular video is the Minister for Local Government for Uganda. His name is Minister Busiu, right? He is one of the leaders or the honorables that are spearheading the entire operation exposing the corrupt thing, right? Now, he asked this man that, did you actually use 73 million to build this particular toilet infrastructure that we are seeing? And then he said that no, he spent only 7 million out of the 73 million Ugandan shillings. Now, the question was that, where are the rest of the money? He said he has documents about it. He can prove it that he used 7 million.
But the good thing you are here.
Yes,
So you spent how much money here?
we spent about, I think, 7 million, yeah.
7?
Yes. We put up a slab, which is washable, with a drainage the other side. So people thought for us putting up, there was no planned project for that financial year. We only did it as an emergency measure so that we could have patients instead of going to the general toilet.
You are sure you used the 7 million, not 73 million?
7 million, sir.
You have the papers?
Yes, I have the records.
Let's go and show me the paper.
They are not here, sir.
They are where?
I kept them at home because I've not been in office. I was arrested, interdicted from 2021. I've not been in office.
Now,
So
first of all, you make a crime to keep important documents at your home.
No, I made the copy, sir.
Listen to me. Where is the DPC? They should take you to your home and have those documents. They bring you at the rally in the evening. Yes.
No, what I have is my copies. The main documents, I left them in the office. For me, I only made a report.
You handed over to the incoming in charge?
Yes, I handed over everything.
Now, after dealing with this particular one with his toilet infrastructure, the minister went straight to one particular district called Moyo district. Now, at Moyo district, a very sad incident or cases are happening there. And that is, in the hospital, right? They have two pharmacies. They have a private pharmacy and they have a public pharmacy. When you are sick and then you go to the hospital, based on your sickness or based on your diagnosis, you are supposed to go to any of these pharmacies to go get your drug. Most of the times, you will not get the type of drug that you are looking for in the public pharmacy because it is free. You will find it at the private pharmacy because you are going to buy. Sometimes you see the government stamp on it, but you got it from the private pharmacy. And that is how the minister said that arrest them. About 7 people were arrested in this particular hospital.
Wait for the inspection of Moyo Referral Hospital, where locals reported cases of extortion.
I want to go with him to show me the drugs of the government wing.
Acting on behalf of the complainants, the local government minister tasked the hospital administrators to defend themselves about the public accusations of selling of public medicines and services.
It's a mandate that every general hospital should have private wings in their facilities, and that is what we have here. The private wing is to supplement only when we don't have medicines.
All the antibiotics, especially the orals, were not orals and injectables. Most of them were out of stock, and they have been buying. Definitely, when you go for Caesar and these things are not there, you buy.
At the end of the day, over 7 district officials, including Moyo District Human Resource Manager and the District Education Officer, were all arrested.
In fact, this particular minister is not sleeping. Even at night, he will be visiting the hospitals to check what is going on in these hospitals. Now, he went to one particular hospital at night. That is the Busiu government hospital. I am just a Ghanaian. Now, when he got there, he particularly went there in the evening and he started questioning the in charge, the doctor in charge, asking him about the number of people that works here. Apparently, about 7 people are taking government's money. They are on government's payroll, being paid every single month, but they don't exist in that particular hospital. They don't work there.
How many nurses do you have? Be honest.
Nurses. There are 16.
You are sure?
Yes.
How many people are earning salary here and yet they don't work here? Be honest with me because I have information.
7.
7. I'm only concerned about the ghost staff because now you are overstretching the few who are working and others are earning salary without. Now,
it is not only Honorable Balam that is on this particular operation. We have other ministers like the Minister of State for Local Governments. That is the woman we are seeing on the screen. Her name is Minister Justice Namire. Now, she also visited one particular hospital at Budaka District. Now, it was mind-blowing at this hospital. What is happening there is that the DHO, who is the district health officer, and then the doctor in charge, right? They don't take care of people for free. Meanwhile, it's supposed to be free. They charge for basic operations like you have malaria, you know, those kind of sickness that are not chronic. They charge about 15,000 Ugandan shillings before they take care of you. When it's an emergency where you need serious operation, serious attention, they also charge around 60,000 around 60,000 Ugandan shillings to take care of you.
Justin Namere, accompanied by technical persons, visited Budaka Health Center 4 to verify the allegations. Namere engaged with patients at the facility, some of whom sought for her intervention, alleging that health workers were demanding money before providing government health services. The minister was shocked to learn that some patients were buying medicine outside the health center, despite government supplies being delivered to public health facilities.
That they buy all the medicine, women pay for the scan, they must pay for the ambulance 200,000 just to get them to Mbale. We know that there is no fuel to Mbale that is 200,000. I think even a special hire cannot charge you 200,000 to Mbale, but there is a government ambulance charging 200,000, 100,000.
And at Budaka Hospital too, they were causing artificial shortage. That is the same thing as they were doing at Moyo district, right? There are some drugs that they will tell you, go to this, but go out. The government do not have it. We don't have it here. So they will write for you, go to this particular clinic to go buy it. They show you the clinic to go buy it. If you go to any other clinic, you bring the drug, they reject it.
You saw the people, they were willing to take me to show me the clinics where they've been buying this medicine. And unfortunately, apparently when they buy from some clinics, the doctors reject their medicine. They tell them, no, go back to this specific one. So we need to understand. Some of them were able to point out some medical officers who also the police took statements from them. I was shocked that part of the police, suppose they give them a small sheet that has Ministry of Health, Budaka District, so they give them that thing. And the people had them in real time. Some were saying I'm from buying, others were saying I'm going to buy. Some even had the medicine. And you would find that, honestly speaking, when you check that checklist, this is part of the medicine that the government has sent. But 3 weeks down the road, they are sending people to buy the parishes that we somewhat like.
So immediately the DHO, who is Dr. Elisa Mowani, and also the doctor in charge, who is also Dr. Winfred Mutaki, were arrested right at the spot by this particular minister. And you know, one thing I have realized is that it's like there is a genetic trend across Africa. It doesn't matter whether you are a Ghanaian, you are a South African, Nigerian, or we usually behave the same. And it's sometimes I don't get it. It baffles me. There are people that are making videos, right, mimicking what the minister is doing, Minister Balam is doing.
Of August 2022, you were given 800 million Ugandan shillings to construct, together with the district engineer, and OPD in the other health center 4. That's why we're here today.
Yeah.
So, did you do some work?
I did the work.
Is the work done?
Very well. It's remaining the roofing.
This is the report?
But the wall is very okay and organized.
This is the report?
Yeah.
Afanda, you follow me?
Otherwise, the wall and everything is set.
DHO,
yes.
You first tell me, how much money have you so far used here?
We have used 700 million.
700 million on this wall?
Yes.
On this wall?
This thing take a lot of money. The materials are so expensive. You see, this thing alone. It was not. Some of these questions are best answered by the district engineer.
DHO, district engineer, trust me. You people, since the wall was still curing, you are going to be in Luzira prisons. You're going to cure there, you mature there, you will cure there until this wall is roofed. Kamata huyo. Kamata huyo. Kamata huyo. Afande kamata huyo.
And I literally see this in Ghanaians. I see, if this was supposed to be happening in Ghana, Ghanaians will be making videos like this. I see Nigerians in this, South Africans. So it's like it's a trend. Right now they are making videos, making fun. This is Gossip 24. I really love how Africa is resetting itself. We are taking our own future, our own next day into our own hands, and we are building our countries. We now have leaders that care. This is Gossip 24. Kindly leave what you think in the comment section, and please do me a favor to subscribe if you've not, to like, and then you say, the room is bright because my name is light. Bye.